counting medication or anything, just for the practitioner and the nurses, was like, the basic visit was $250. Well, we could charge that, and then we'd have to slide it to zero because that's a requirement of the program. And insurance companies.
This was just family.
This was just family planning.
Family planning side.
Do you, how long do you anticipate for the rest of the presentation?
I'm on the last page.
Okay, because we're up against the clock here.
Right.
I thought about coming back. If you have
Does
some
that
more
work for you
extensive
guys? Is that,
questions.
to
Do you
come
want to
back,
at
how's your
1:30?
time? Can you come back at
Do you want us to
1:30?
come back at 1 or some
1:30.
other day?
1:30.
I have a 12 and a 12:45 appointment, and I won't be back till about
But I'd like you guys not to have to
1:20
rush,
or
so what does that do to your day?
Well, I think we want to do whatever you would like us to do. The question is, do you have questions, or, because we don't have that much more to say.
No, the last page was just a breakout of the funding resources that pay for our budget.
Okay.
So whatever your pleasure is.
I do have a couple of questions. Up on the top of your big elaborate spreadsheet, do you mean 11/12 instead of 10/11?
Oh, I do. I caught the date on there. I thought, oh, I didn't change the heading from last year's
Yeah.
template.
And then
Yes.
some of these positions, we had some, blah, 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 let me look here. In chronic disease prevention, we had healthy communities, .4. We had dental services support, .4. Living well, .4.
Those are all extra help positions.
Okay, they're all included in this extra help
Yes.
of 1.35.
Yes.
Is the doctor in there too?
This
Yeah.
doctor knows.
Because he's,
Yes,
Maybe
he's
0.6 or
he's in
something.
extra help as well. He's spread out
Okay.
little bits and pieces of him across the
I was
clinic
trying to find
programs.
these folks and I couldn't find them.
Yeah.
Okay.
I actually don't get anything from HR for those
Mhm.
when I get my payroll sheets. So I have to calculate all that out, and then I just plug it in.
Cheryl, do we know how many of our patients at the clinic are like no pay at all? 10%, 20%, 40%? Have we ever worked that out?
We do have those figures. I don't know it off the top of my head. We do everything we can to enroll them in the C-Care program, so we get something.
Sure.
And we bill every insurance that we can. But I'm guessing, I would think it would be at least 40%.
Just a
of our
guess.
clients.
That's good.
It could be higher with the current economic situation. And it's self-declared. We cannot ask them to prove their income. We can in the WIC program, but not in the family planning program.
So if I came and dropped in, you couldn't ask me?
We can ask you, but
We will ask you.
we will ask you to fill out a form, but we can't ask you to give us
Verify.
proof of income.
You have to provide wage slips or anything.
So I can come in with one shoe on, one shoe off, limping in.
You could come in your Maserati,
Park around the corner,
yeah, or out front.
if I had one. Okay, I think we're in recess until 1:30.
Do you want us to come back, or are you?
Well, Commissioner Perry, you have any more questions?
No, I think that's it. I mean, if we can start to put together.
This is our first run-through.
Yeah, it's
Right.
just a first look at the budget, and if we can start to put together some of those numbers on the clinic side for next week, that'd be really helpful.
Yeah, no problem. I can get that actually to you probably by tomorrow.
Good, yeah, because it'll just be simple. It'll be, our costs are $1 million. We see 8,000 patients, we have 8,000 clinic visits, and we just divide it, and then it'll let us know what our potential cost per visit is on the clinic side.
For the public, we're going next Wednesday to Benton County to talk about how they do a countywide health district. And with that, if that goes well and everything comes together, then we would get reimbursed for all our costs they say they're eating.
To get a good portion of it's 200% of poverty and under, which is the majority of our
I mean, that's the majority, so.
client base.
And then the doctors and nurses in the private practice also get paid. They're not flooding into the hospital and emergency room. because that's the only place you have to go.
Well, it would dramatically help
Yeah, everywhere.
our local hospital and all our hospitals if we could do that, because it would
Do we
take the
have to
pressure off
notice that
everybody's
meeting that we're going to?
Are you going to be conducting
Gathering
other business?
We're gathering information.
As long as you're not conducting county business or
No.
deliberating toward a
Can't
decision
discuss
on
it.
county business.
We're just listening to Benton County.
We're going to ask a lot of questions.
Yeah, and you just be real careful, you can't be discussing anything like
Yeah,
county
right.
business. Other than that's what you have to notice, so that the public's aware of when you're discussing stuff.
Why don't we just notice it anyway?
Excel spreadsheet.
It's safer if you do.
Let's do that.
A lot of the counties
Wait,
are
I
already.
already asked you.
Okay, we're in recess.
I mean,
Tell you that.
All right, we will reconvene our budget session for today, March 16th. And next is Health Department. Oh, road.
Dr. Rowe?
No, Dr. Sharon. Oh, Sharon.
Go ahead,
Okay.
dive into it.
And you have the budget there in front of you.
The
and you
pretty
can see-
colored one?
Yeah, the pretty colored
Okay,
one, so you
all
can
right.
see what goes where. Our increase in personal services, we hope to be hiring 3 additional people or more after July 1st.
How about next Monday? Serious. The river's out there at flood stage right at the moment, it's right at the top of the bank.
It's dry out tomorrow.
I'm serious. It's Monday. What do you think?
I agree. And we've got,
Our budget for this year is, I mean,
What?
we just had to transfer $100,000 in. for
Well, I can read
services.
here, it says unappropriated contingency, 3.8 million.
Yeah,
Yeah, sure.
well, but that's set aside for different things. It's not
I
just-
understand, but it says unappropriated. If it's set aside, it has to be dedicated.
Well, it's unappropriated or contingency. It's the money we needed the first of the year just for the road department, for the fleet service department. Part of it's for the bridge
Yeah.
money we're setting aside for
Yeah.
Gaylord. And then we have a small reserve,
Yeah. How much is your small reserve?
2.3 million,
Is that all?
which isn't much.
Okay, so I just assume you call them back on Monday. Really? It's, I have to have a second, though.
I would absolutely second that. The reason why is because we've got so many people calling in. I mean, the reason I was late was because we just had, well, one, we knocked another bus out of service for the Myrtle Point School District. Their mechanic talked to me this morning.
That's the second one in a week?
Yeah, and the hoods are cracking, they're losing, they've got axle problems. I talked to some folks up at Northway Lane the other day. I went up there and took a look. And then I got an email. I noticed that I just cranked out and somebody just busted up the front end of their car the other day going to a call at the hospital. One of the doctors, $831 worth of damage. And
You know that there's ongoing issues with Northway.
yeah, they had a farmer out there hand digging the ditch, and the Hauser Fire Department was trying to blow out the culverts because they were so full of mud and debris. And we got to figure out a way, and that's what I'm coming to realize. And I know you're shorthanded. I totally get that. I'm not trying to shuffle it on you guys at all. But we've got to figure out a way to get these gravel roads under regular maintenance schedule because
Out
it's,
on North Bank, you know, that little short section that got repaired, that was sinking and all that stuff, and now it's gravel. Well, the neighbor's been going out there and filling the holes every so often. Well, he had a heart attack while he was shoveling out there. He doesn't blame the road department any, but,
That's a nutrient hole,
yeah, you just don't have the people. You need people.
yeah, I was just putting a memo together for you, John, just 5 today already, and there's a bunch I haven't gotten back to yet, so. And they're all the gravel roads mostly. I mean, you guys do a wonderful job on the pavement and the asphalt, but we've got to do something to figure out what sort of personnel we need to get these gravel roads in a regular maintenance loop.
But I don't think that we can just call people back, can we?
Yeah, there are certain notice provision, callback provisions. I mean, you might get lucky. I don't have the collective bargaining agreement in front of me, but there is a callback. I think they have 14 days to respond. But that's just off the top of my head. I'm not sure if that's the.
Well, that's
actual amount,
respond.
but-
but
That's
if they
not putting it in
respond
motion.
tomorrow, they're fine.
Yeah, if they respond.
I mean, they got
tomorrow-
14 days. If they don't respond, then you go to somebody else. But
Exactly.
that has nothing to do with whether they call in
No,
or
I'm
not and
just saying
start on
there's-
Monday.
There's a process. I'm not entirely sure what
Yeah.
it is, but if you pass this motion, then I will work with JR on that and get Mike Lehman involved to
Okay.
work with him on
Where-
it.
Who's not here? He was here this
I think
morning.
he'll be back, isn't that, no, that's not this.
No, that's my stuff.
Okay,
No, but I'll go see him next.
okay.
Are there any issues for you in bringing somebody back right away? That the
You tell
board
me I
needs
have
to
to
be
bring
aware
somebody
of?
back, and I'll bring somebody back.
Well, I'm just saying, are there
No.
any problems that the board needs to be aware of before they?
They're shorthanded. They've been that way for.
No, I hate to have these guys so stressed,
And John's told me before he needs people.
Right.
and we need
And I
to
was just
take,
thinking, I'm just coming back from River Point, and I was thinking, the river's right at the top of the bank right now, and part of it's flowing over. The north bank is going into the fields, so it's over the top now. But the main stem is right at the top, and I'm thinking, with all this rain, you're gonna need the extra help.
Then we'll basically throw this budget out, because we're totally new beginning balance.
Well, let's go through it anyway. But you understand, we're doing all of these as a first run-through. Then we sit down and try to analyze them and think about them, and then come back and see if we can make any adjustments and ask questions in more depth. So,
yeah, this is
Did you
just a
want-
presentation, you guys.
Well, basically, the rest of the expenses in the road department are, well, they're based on,
May I just ask a question before she proceeds? Did you vote on that?
all in
motion?
favor?
Aye, we just did.
So I'm assuming that was a motion when you were discussing.
Uh-huh.
Bob made a statement.
I heard him make a statement, I didn't, that
Well,
was.
Here's a
Pam
form of the
seconded.
motion.
I'm
Okay.
sorry to interrupt,
That's-
Sharon.
that's all right.
I heard the motion, that's why I knew I didn't have a passage.
so the rest of the road department expenditures are basically the same as they were last year. We have $1 million in asphalt. Our utilities, training, contract services are basically all the same.
You expect an increase in fuel taxes, huh?
We expected increase in the cost of fuel.
I was looking at this, I guess this is.
Yeah, there is a
Mary's
bump in,
hand, yeah, this
yeah, there's a
one.
bump in fuel tax, right, to the department this year, that's what he was asking.
Well, I have one in front of the other one here comparing.
Unfortunately, they counteract each other, but there is a, do you know what the total bump
There is
is?
an increase in the fuel tax.
Do you know what the
Okay.
total bump is, Sharon? in fuel
That's
tax?
about, a little short of 600,000.
Yeah, that's, I think.
That's substantial.
Well, it went down 700,000 in federal highway work administration.
Mhm.
And of course, the federal force, because we Wagner are going down.
Yeah, dramatically.
So the difference is a little over 200,000 between last year's budget.
We lost 140,000 in wagon room, roughly. Just doing the mental calculations here.
221,000 better than last year's figure. And that's what we had pretty much up personal services.
Your STP is about the same. You expect how much of an increase percentage-wise in fuel costs?
Well, last year we budgeted 300, or last year.
You were
we
just
spent-
talking about fuel costs.
Yeah, we went up to 500,000 this year.
From,
We spent 400 in 08, 09. We're on track to spend approximately the same amount this year.
about,
So we're up to the $100,000.